When an individual becomes afflicted with cancer, the main goal of the patient, their families, and professionals in the field of oncology is, generally, to successfully overcome this deadly disease. There are innumerable treatment options for all involved to consider, and this decision can become a daunting process. For the scientific community, for example, the physicians that contribute to the site, www.sciencebasedmedicine.org, medicinal advancements such as chemotherapy and radiation are considered to be the most revolutionary and effective treatment options. Others who specialize in this field prefer a more non-traditional or holistic method, for example, the complementary and alternative medicine, or CAM method. Though there are many other substitutes for patients to consider, these appear to be the major contributors to this debate. Upon performing research, both parties have compiled statistical data proving the effectiveness of their consecutive treatments. They have utilized scientific research to provide factual data that patients can access in order to make an informed decision. Both options have their benefits as well as their drawbacks. But what if these two groups were able to collaborate in order to increase the likelihood of success or decrease the stress placed on their patients? As I previously mentioned, the main goal of those attempting to treat this disease is to eliminate the carcinogenic or cancerous cells. Those in favor of more scientific methods, such as the previously mentioned authors of the Science-Based Medicine site, favor more traditional methods, such as chemotherapy or radiation. These treatments are capable of stopping mitosis and therefore cell growth, or even damaging the DNA of these cells enough for cell death to occur. Science-based medicine is not alone in their preference for this treatment. In 1997, due to his own battle with cancer, the biking champion Lance Armstrong began the campaign Live Strong to fund cancer research as well as to provide information to those who are affected by this terrible disease. Though it is not an academic source, the Foundation's website provides patients with in-depth information regarding everything from exercise regimens to data on different treatment options. According to their site, in low-risk forms of cancer, chemotherapy, on average, is effective between 70 and 90% of the time. Another modern medicine advocate comes to us directly from the Science-Based Medicine website. Dr. David H. Gorski, a surgical oncologist and the current medical director of the Alexander J. Walt Comprehensive Breast Cancer Center and the liaison physician for the American College of Surgeons Committee. In addition to these attributes, he is also the Associate Professor of Surgery and Oncology at the Wayne State University School of Medicine. His contributions to this site include articles such as Alternative Medicine Use and Breast Cancer. In this article, Dr. Gorski reports and comments on a study performed by the University of Alberta. In this study, 185 women were observed, and the survival rates were documented. 87 of these patients refused traditional treatment and opted for the CAM method. According to this study, the women who chose holistic methods had a 5-year survival rate of 43.2%, whereas those who opted for surgery, chemotherapy, or radiation showed a survival rate that was almost double that, at 81.9%. On the other end of the spectrum, many specialists, such as Dr. John Chang, a pharmacist at the National Cancer Center of Singapore, have conducted their own studies and concluded that the alternative therapies utilized in their study, such as traditional Chinese medicine, acupuncture, and massage therapy, can reduce the rate of infection for the surveyed population by roughly 12%. It can also decrease the need for antibiotics by as much as 10%. Using both of these methods cohesively has the potential to create more jobs in the medical and holistic communities. This collaboration may also lead to the alleviation of some of the more intense symptoms and a better quality of life for their patients. According to my research, this alliance may be less invasive and more cost-effective for the already suffering patients. Yet another example of the effectiveness of both alternative therapies and modern medicine in cancer treatment comes to us from Singapore. Constance L. Saw, a physician at the National Cancer Center of Singapore, has provided a current peer-reviewed article that studied the effects of different forms of pain management that were utilized by some of the center's patients. Many turned to their doctor and found relief in the form of some sort of drug. Others turned to the more natural realms of massage therapy and acupuncture. Both were found to have statistically significant positive outcomes. For anyone who has personally experienced this deadly disease, you know the strain it can put on the patient's body. According to Dr. Jordanka Kirkova, another oncology specialist, there are many symptoms involved with not only the cancer itself, but resonating from the treatment as well. These can include, but are not limited to, clusters of symptoms such as pain, depression, and fatigue. Other examples can include nausea, weight gain or loss, weakening of the immune system, or infections. Many scientists, medical professionals, or national practitioners have slaved away to find some way to alleviate these adverse side effects of the already devastating disease. One cost-effective solution aimed at treating some physical as well as several psychological side effects is massage therapy. In a study performed in Australia, Eleanor Oyston recorded that patients that received 30 minutes of therapeutic massage 5 times a week on average had higher levels of certain hormones, such as dopamine or serotonin. Obtaining higher levels of these hormones, according to the peer-reviewed article, can help regulate certain vital bodily functions that can be adversely affected by cancer, such as the sleep cycle or appetite. Though the symptoms are a major factor in the battle against this deadly disease, doctors must focus their attention on eliminating the dangerous cells. The aforementioned patrons of modern medicine tend to favor surgery to remove any accessible sections of the tumor, chemotherapy to stem cell growth or mitosis, and radiation to damage the DNA of these harmful cells and cause cell death. Though as previously mentioned, these treatments are very effective for many types of cancers, this treatment comes with a rather large price tag. According to the Livestrong site, this therapy can range anywhere from $100,000 to $300,000. For low-income patients, this may not even be an option. This is where a collaboration should ensue. Massage therapy, for example, can be attained for a relatively low price, and as Oyston discovered, can be very beneficial. Other therapies include hypnosis, acupuncture, or even yoga. Some hospitals may offer these complementary methods to patients for little to no charge. This system encapsulates the mental as well as the physical health. Those who are in favor of these treatments promote it as the enhancement for the well-being of the body and soul. Wouldn't it be wonderful for the professionals in this field to be able to create a partnership to improve the well-being of their patients? Working in tandem, according to the statistical data presented by both sides of this debate, can help lead to a better quality of life for those who have been diagnosed with cancer. Both sides of this discussion express clear, concise, and very opinionated views. Science-based medicine favors the term pseudoscience when referring to holistic methods. In yet another peer-reviewed journal written by Dr. Andrew W. Campbell, he equated the advancement of modern medicine with a regression in healing. After 34 years as a family practitioner, Dr. Campbell claims that doctors are so focused on treating the disease that they lose touch with the patients and their needs. Cancer, as previously mentioned, is accompanied with many adverse side effects. Focusing on the disease rather than the patients themselves, according to Campbell's article, can decrease the well-being of the person affected by this disease. In some scenarios, it can even negatively affect the patient. This is yet another reason why I believe both parties can benefit from one another. According to the previously stated statistics, utilizing both methods resounds in a greater outcome for the patients, their medical or professionals, and their families. Cancer is one of the most deadly and widespread diseases known to the modern world. More likely than not, it will touch your life or the life of someone you know or love. Personally, I have had too much exposure to this disease. It's a violent killer that is capable of mass destruction. I dream of the day when that cure is discovered. Until that day arrives, the best we can hope for is an overall improvement in patient care and symptom management. Imagine yourself as one of the patients. Imagine you had just received the devastating diagnosis that everyone dreads: cancer. Would you not search tirelessly for a treatment that would encapsulate the care for the body, the cancer cells, and your physical and emotional well-being? To reiterate once more, there are many options and decisions that a patient must face when battling cancer. By discovering a treatment that is effective and as non-invasive as humanly possible, we may be able to minimize the stress placed upon the innocent victim of cancer. The most important focus must resound around the patient and their survival. When a patient successfully treats both body and soul, everyone benefits.